How pain was handled prior to anesthesia, the patient would be given a shot or two of whiskey and literally a stick to bite on while they operated. And it was a brutal time, and you can imagine what patients facing operations were fearful of. Hey GQ, I'm Dr. Leonard Lee. Welcome back for part 2, where I'll be breaking down more surgery scenes. This is The Breakdown. First up, awake.
And I want you to take this, inject the heart, and put it in the body.
That's something you would never see in the operating room. Her hair would be covered, and she would be wearing a mask. The purpose of hair covers is to prevent hair and dander from your head falling into any surgical field or surgical wound. So this is a heart transplant, and they've removed the patient's heart, and that machine that they're showing now is the heart-lung machine, and that is what's supporting the heart functions, which is pumping the blood, maintaining a blood pressure, maintaining oxygen in the blood to feed your vital organs so that they can be sustained during the time that the transplant is going on. Heart transplant is actually one of the most successful transplanted organs in the entire body. The most common transplants are kidney transplants, but the heart transplants have the best survival rates in terms of patients and also the least amount of rejection.
You sure Larry's not close?
We're fine, don't worry.
We tape their eyes shut to prevent corneal abrasions. Some people sleep with their eyes open, and we do that to prevent injury to the actual eye itself.
All right, I need some suction.
No, please, God, no.
At that side, too.
Okay.
Oh, no, please, God.
There are multiple parts to anesthesia. The general parts about anesthesia are, one, to maintain a level of sedation so that the patients remain comfortable in terms of pain and sensation to pain. The other part is to keep their brains quiet so that they're not aware. And occasionally, one part of that anesthetic management may fall a little short. There are reports of patients having awareness during operations where they hear conversations, they're aware of what's going on around them during the course of the surgery. There are a lot of things that the anesthesiologists have at their disposal to try to prevent these things from happening. Different monitoring devices of brain waves, etc., that can help prevent these things from happening. Next up, 127 hours. So this is absolutely brutal to watch, and to think that someone could actually cut their own arm off is almost seems as if it would be unrealistic. But we all know that this is actually a true story. So the purpose of that band that he put around his arm, it's called a tourniquet. And the purpose of the tourniquet is to cut off the blood supply to his arm so that when he cuts through those major blood vessels that feed his hand, he doesn't bleed to death. So it's actually a very, very smart thing to do. So he's probably touching a nerve there, and that's probably what's causing more intense pain than he was already feeling from the cut and the break. It is true, though, that intense pain can cause you to pass out. It can cause you to hallucinate. You can get disoriented. Pain is an incredible thing. How pain was handled prior to anesthesia, the patient would be given a shot or two of whiskey and literally a stick to bite on while they operated. And it was a brutal time, and you can imagine what patients facing operations were fearful of. Next up, Grey's Anatomy.
All systems ready.
The Da Vinci SI HD surgical system.
That is an actual surgical robot. That is the company Da Vinci, and the S was one of the first generations of the robot. They came out for use in surgery.
All systems ready.
That is what it looks like. It does not talk to you, however. They made it sound like something out of Star Wars where the robot is actually conversing with you.
Surgery feels pretty good, doesn't it?
So you can see that she was sitting at a console, and that is how it works. The actual robot is in the patient and docked to the operating room table. The surgeon sits away from the actual robotic arms and sits at a console. And in the console, she puts her head into it, and it provides for a three-dimensional view, so you have depth of field, and it provides 6 times magnification. The hands are put in these casters that translate very large motions of the hands into very fine motions at the fingertips of the actual instruments that are within the patient. The advantage of the robot is that it removes tremor. All of us have a certain degree of tremor in our hands. The longer the instrument, the more tremor you see at the tip of the instrument. It takes that tremor away. This particular company is the industry leader for robotics. And when any program or hospital or university hospital, academic medical center is talking about robotic surgery, they are talking about using the Da Vinci. Next up, ER.
Don't pull so hard with the Babcock. You'll tear the gastric artery.
I'm not pulling.
The hell you're not?
Dr. Morgenstern, you're obscuring my field.
Oh, son of a bitch! You tore the left gastric.
Look, I wasn't anywhere near it.
Suction?
So in the operating room, it's really rare for things like arguments to occur. It just wouldn't happen. There is conversation, there is direction, there is correction. Things like that do happen, but it's much more calm, it's much more collegial. The primary surgeon always stands on the right-hand side. Because Peter Benton was on the right-hand side of the patient, that means that he is the primary operator for that operation.
Let's move.
Give me more suction. I can't see what I'm coagulating.
All right, we have to open.
No. We can control the bleeding.
So coagulating is a way to control bleeding. It uses electrical current to actually burn small blood vessels and stop them from bleeding.
I'm starting internal massage.
Still in VTAB.
So that's the endotracheal tube. That's the tube that is connected to the ventilator, and it goes into the patient's main windpipe, and that can provide oxygen to the patient during the course of the operation. When the patients are under general anesthesia, they can't breathe for themselves, and so the machine does the breathing for them.
I can't find the bleeder. All right, we've got to crack him. Damn it, I said rib splitter. Let's move, people.
So during any type of an elective general surgery case, it'd be really unlikely to require opening the chest to get control of bleeding. The purposes of opening the chest is to put a clamp across the aorta. The aorta is the big blood vessel off the top of the heart that feeds blood to the entire body. And by clamping off the aorta, you allow the heart to fill with blood, and so that the heart can do its job of pumping the blood at least to the brain and to the lungs, while you try to get control below the diaphragm in the belly. It'd be very, very unusual doing that during any sort of general surgical procedure. Next up, scrubs.
So you wanted to talk to me about your appendectomy.
15% of all surgical complications are anesthesia related, so I would like to use hypnosis instead of the traditional anesthesia.
With today's science and anesthesia, the likelihood of anesthetic complications is far less than 15%. Patients these days, because of the internet and media, come in fairly educated about their disease processes, what operation they can get, what operation they might get, but it's rare for a patient to actually dictate to you what they want and in what direction they want to go.
My appendectomy patient wants me to use hypnosis instead of anesthesia.
Hypnosis is a very powerful tool. It's helped people with depression and weight loss. It helped me quit smoking.
Hypnosis is for birthday parties and bad Vegas lounges.
It is true that hypnosis is a very, very powerful tool, and it can help with all those things that she just talked about, but it'd be very, very unlikely to be used in surgery. Appendectomies are fairly common operations. The appendix is in the lower right side of the abdomen, and it's what we refer to as a vestigial organ, meaning it has no role. There was some role in immune response and things like that many, many years ago, centuries and centuries ago. But today, it doesn't have a purpose, but it can get clogged up and it can get infected, and that's what leads to what we refer to as appendicitis, or inflammation of the appendix. And that is one of the reasons why the appendix would be removed. All right, that's it. Thanks for watching these clips with me. I hope you learned something. Until next time.